One semester I may feel as though I understand everything, but in another one, not so much. Hello, my name is Jeremy. I'm a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and hit the notification bell for future videos. We upload on Wednesdays and Sundays, and let's go ahead and get started. So, in the topic of this video, I'm going to ask, is it okay to be average in nursing school? And I'm going to say it depends. What is your definition of average? Is it to pass and basically go along? Is it basically be book smart? Or is it basically be clinical smart? All these are pretty much contributing factors into going into it, because you can be book smart and not necessarily clinical smart, and you can basically be both. I think the better balance of this is to basically surpass your limits, because what's average to regular people may not just be average to you. Average is up to a certain extent a frame of mind, but reality kind of lets you know where you're at. It allows you to get in between the gap of not being lazy, but also trying to press yourself. In a sense, that's what healthcare is, and that's what nursing school is. It's an evolution of the person. You can have the grades and you can have the know-how, but if you're unable to apply to the clinical setting, it's all essentially useless. So from a stable mindset, average is not good, but that's the average of the overall quality that is a little different. You see, if you have an average that is basically meets the standards, it's not going to hurt you to basically go above it. But if your average is well below the standard, you got to bring it up, you know? For me, it's every semester it seems like it's a little bit different. It seems like a self-growth within each topic. One semester I may feel as though I understand everything, but in another one, not so much. For me, up to a certain extent, that semester was OBGYN and a little bit of pediatrics. Now, I did well enough to pass both, but if more effort was to basically get above my average, I think I would have done a lot more. And every student has basically felt that way up to a certain extent, even if you receive an A in the course. And I'm not discrediting the A. The A pretty much shows that you're pretty much at like teaching level to go with it, and not at the minimum level. Which is exactly what we really need. It's just like, it's so often that we basically focus on lowering the bar that we forget the factor that we have to elevate it in order for self-growth to happen. We're going to learn this regardless, if it's basically in the classroom, if it's in a clinical setting, if it's basically out in the real world, especially in the middle of a pandemic. In the middle of the pandemic, I have literally witnessed classmates and within myself, different mindsets kind of change on, do I really want to deal with this? Do I really want to deal with having a mask on, gloves, and a gown and all this up for 12 hours? Do I want to deal with being overworked and underappreciated? Yeah, the money is decent, but at the same time, it's really underpaid for the amount of work. Nurses talk about all the time that they're sacrificing mental health for basically helping out their colleagues, which is great for teamwork, but how does that work for yourself? Average is, at the end of the day, who can do the job safely, who can get the job done, and average is a higher standard than a lot of people are willing to realize. The state works at a average level, and in practice, you're always going to learn something new. Whether that's getting a personal relationship with the patient, whether that's basically learning a new skill, it all depends, because healthcare doesn't just stay stagnant just because you learn it in school. In all reality, it's a lifelong progress from the paramedic level to the nursing level to and I'm speaking from the nursing student perspective. These are things that you're going to experience on the job. The schoolwork, yes, in the theory it's great, but the reality of it is nothing really matters if you know how to basically do everything of it. It's what you can basically do to get the job done that matters. And that's the hard part. Average in regards to nursing, like, we downplayed a lot. In all reality, average is the standard, and to be honest with you, the vast majority of the industry doesn't even reach the standard. I'm not saying not to go above and beyond the standard, but you have to reach average, which is NCLEX level, which teaches you at the point where you are able to function as a nurse in whatever state safely. So the ultimate answer to this question, do grades matter? Yes. But I'm not going to say it for any administrative reasons. I'm not going to say it for any grad school levels. Grades matter for yourself. And here's why. Because you are your own biggest critic. You didn't pass that test? You know you didn't put in the time. And if you did put in the time, you know you didn't contact the right people. Or maybe you're just too stubborn to ask for help. That's the reality of it. So you tell me in the comment section below, what is average to you? For me, it's meeting the standard. And for me, okay, meeting the standard is difficult as it is. And it is great to go above and beyond, to go above this standard. So that's all I got for the video. Like, comment, and subscribe, and see you in the next video.